The state of the healthcare system has been a concern for some time. The Richidze project will launch a detailed report on public healthcare in the Free State in particular. It says there have been some improvements, such as an increased availability of condoms, but challenges persist, including excessively long waiting times and dire progress in the provision of a 3-month supply of ARVs. To discuss this further with us, we are joined by Ndibuo Rambau, the Richidze project coordinator. Thank you very much for your time here on ENCA, Ndibuo. Just first of all, explain to us what you mean by improvements in the Free State in particular. It's been quite a problematic province in terms of public health care in our country.
Indeed. So this is the third edition of the State of Health report for the Free State. We are launching this report, and we've now following a district approach where we present specifically to the district so that they can come in and help resolve the issues. So there's quite a number of reasons why we see our public healthcare system failing, and amongst those reasons and amongst those issues is when people living with HIV feel the brunt of either not being able to collect their treatment or not being treated well at the facility. So in the Free State, we're still seeing that there are quite a lot of staff shortages, where only 10% of facility managers reported that they had enough clinical or non-clinical staff. And in them not having enough staff, this also exacerbates other issues. We find that now waiting times become quite long. We find that facility staff is also exhausted, they are fatigued, and this also has a big impact on staff attitudes, which is something that we've heard a lot from people who are using clinics in the Thabo Mofokeng district. Patients or people who are using facilities are indicating that, look, it's not a pleasant experience to come to the clinic. Sometimes you're shouted at, sometimes you're not treated well. We see our facility staff, dragging their legs, taking long tea breaks, and this really breaks the heart of public healthcare facility users as well.
How much of this, Ndibuo, has to do with the fact that for the longest time now, unions have been practically begging the National Department of Health to fill up vacancies, and the ratio of patient nurse or patient doctor is at a very bad scale at the moment? So how much of this contributes?
One could say that that is a contributing factor, specifically because even within Richidze, we have asked the department to fill up vacancies, and that is one of the key recommendations that we have been hammering on for the past 3 years. And if you look at our solutions that we've presented to the department, you will see that this solution has never really been committed to by the department, to an extent that 65% of facilities even said that they would like additional clinical staff from the PEPFAR district-supported partners in the province, which is Right to Care and Wits Reproductive Health Institute as well.
All right. Now, when it comes to solutions, I'm sure that particular event is going to also discuss solutions to the healthcare problems that we find. And I mean, I know I can't ask you about all the other provinces, because we know with medical legal claims, the leading provinces are Gauteng and the Eastern Cape. And I wonder where the Free State is in all of this. But the solutions that you've come up with, what are they?
So we've got solutions based on different issues or indicators that we have within the province. So, for example, when it comes to issues of around ART continuity and how people living with HIV are collecting their treatment, the Free State is doing the worst in terms of ARV refill length. A lot of people who we spoke to are still collecting between 1 to 2 months refill, compared to 64% of people living with HIV in Mpumalanga who are collecting a 3 to 6 month refill. So we find that obviously the clinics are going to get very congested, because I'm just coming in to collect my treatment. I'm going to wait there the whole day when I could literally just be taken to an external pickup point within my community, or I can just be given that 6-month refill and know that I just come to the clinic twice in a year, and this helps to decongest the facilities. And in part of some of our recommendations to the department, we are asking that, it's normal to miss appointments at times, and you might have a treatment interruption as a person who's living with HIV. And we are asking the department to ensure that staff and facilities are welcoming people back to the facilities and actually enhancing the Welcome Back campaign, because we've got all of these standard operational procedures procedures that are put in place. However, we find that some facilities are not using them as they should. So in most of our recommendations, we will ask that let us also stick to the SOPs, especially when it comes to issues around transfer letters, where people living with HIV, if you don't have a transfer letter, you are sent away and told, go look for that transfer letter. At that time, the person does not have treatment, and this means that they're disengaging from care, and this has a very big impact on their health as well.
All right. Well, thank you very much for speaking to us there, Ndibuo, and thank you for your time here on ENCA.